Good afternoon, everyone. We are in Ukraine Crisis Media Center, and today we are going to talk about the medical topics, and also we will cover the things which our army needs, which the defenders who are wounded need. And in fact, we are going to talk about how our society has to perceive the needs of both the army and the medical facilities and how they should respond it. The topic of today's event is vacuum therapy of the wounds. So will there be enough resources to save lives? And this event is organized by the head of the project Vacuum Therapy, project called Charity Foundation, Mr. Dmytro, greetings. And also today we have Dmytro Sydorenko, the head of the Polytrauma department, surgeon of the Kyiv City Clinical Hospital of Emergency Medical Care. Good afternoon. And also Yuriy Rybyanets, the head of the Purulent surgery department, the Kyiv City Clinical Hospital number 6, honor doctor of Ukraine, and also Axon, British soldier, veteran tactical training instructor, founder and soul of the International Support for Ukraine Association, Mr. Andrings, good afternoon, and also Olha Klymenko, paramedic, tactical training instructor and volunteer. Greetings, my name is Igor Stambul. I am the moderator of today's event. In fact, in this studio, we already met with Mr. Dmytro. We had the meeting dedicated to the vacuum therapy of wounds, and it was something very new for me because, I was looking in the direction of the tourniquets, but it appeared to be that we are already in the 21st century, and how important this topic is for our army, how important it is for the perception by the society. Mr. Dmytro, the floor is yours. Let me be the first one as initiator. So, the first time I found out about it was in March 2022, and before that I was not related to the medical sphere. We had the request, we donated, we found the money, and I decided to dive deeper into the topic. I called my friends in France, in Israel, in Germany, in the US, and they said that it's something really vitally important because, all of these things, the previous methods that were used, so they led to the amputations, and I understood that it is somehow something I have to work on. And since that time, I think that until the war is ongoing, that is a challenge which I have to cover as much as I can. Okay, so if speaking of the numbers, we have the numbers in press announcement, and how many, what kind of numbers we're talking about? Well, during this time, the charity foundations and volunteer organizations organize their efforts, and together with the Ministry of the Medical of the House, we have conducted the survey, and we found out that in Ukraine we have around 4,000, I guess now a bit more, items of equipment, and that is thanks to the fact that the society responded, and we have collected everything from all around the world, and that helped the doctors to provide the efficient assistance, and that is something that made Ukraine to make step in the future, and that is a more modern methodics which helps to heal the wounds. Okay, so Mr. Dmytro, I would like to ask you how this technology is revolutionary, and how it is it popular in Ukraine. So, let me start from the point that one of my doctors, the doctors of my department, said that the developer of this methodology has to get the Nobel Prize. Why? Well, first of all, there are a few aspects of it subjectively, from the perspective of the patient. So it reduces pain. Why? Because most of the operations soft tissues are under the complex painkiller, and after the operation the patient does not need a daily treatment, and they are very painful. That is the first thing. Besides that, this methodology fastens the healing of wound and its preparation to be covered, and it can be the covering with the local tissues or maybe with some surgery, plastic surgery, but nevertheless this methodology helps to prepare the wound for the further treatment. And the third aspect is the working load of the staff, because in this way even the daily treatment of the patients that is both the expenditures for the materials and also some extra work for the staff. Without this methodology, without vacuum therapy of wounds on this stage, considering the reality we are facing at the moment during the full-scale war, during the big number of the wounded servicemen and civilians, it is impossible to show some positive dynamics of the treatment. Thank you very much. Maybe you can add, and maybe Mr. Yuriy, you could add and tell us more details about what kind of equipment is it, how big is it, and how does it need some extra settings, extra adaptations, and maybe some extra procurements, how independent it is, and what do we need for it to be functioning. The question is clear. First of all, I would like refer to the history, how this methodology appeared. Some say that that is one of the Soviet scientists who left abroad and who invented this kind of methodology of vacuum cleansing of the wounds, but nevertheless I do not remember this part of the story. That is something we don't remember well, but the first this type of equipment was invented by KCI. They have the patent, and for more than 10 years they were not allowing to sell and to develop these type of equipment. In fact, there are a few types of vacuum equipment. First of all, we have to understand that vacuum therapy is divided into, the equipment, they can be stationary and they can be mobile. All of these, both types of equipment can work with accumulators, so they can be working autonomously for up to 20 hours. And if it is a stationary equipment located next to the bed of the patient, in this case there is a big accumulator and the capacity is bigger and it can work longer. If it is individual equipment which you can carry on the belt like a bag, and it weighs around 2.5 kilo, then of course without electricity it can be operating for 2.5 hours. So it means that the patient can serve him or herself, do some work and do something. And the vacuum therapy itself, what is it? That is equipment, the electric vacuum, which has a software, and you enter the pressure and the time of operation. It can be working all the time. That is for the cleansing of the wound, when you need to clean it from toxic issues which are produced by the body in the wound when it's healing. And the second type, the second regime, it has actually two regimes. The second regime is the regime with interruptions, which helps to grow the granulation tissue, and after that you can continue treatment to cover the wound with plastic or with local tissues. Also, these vacuum equipment can be for the surface wounds and internal wounds. And besides that, thanks to volunteers and the state procurement, so we are able to use equipment used in Europe and VAC. That is equipment, when we are entering it in inside the body, it can help to lose the tissue there, because if the wounds are very big, in this case it's very hard to cover them, and the patient loses a lot of life resources to cover this wound. That is a brief information on how this vacuum equipment works. So that is a mechanism, so to say, a electro vacuum plus the cover. White is vacuum because there is film, and between the device and the film there is also the screen where the doctor is setting the way it works, and this in this way this kind of device can work for 2-3 days. It can work even more, but it's better not to do that. And all of the tissues are collected in the container. And if the device, this mechanism, it works a long time, in this case you need lots of materials, for example, and every company protects their development. So they are developing this equipment in the way that the containers and the film can be used only from their company, and therefore it's a problem. And personally, I faced vacuum therapy back in 2010. The first person who brought this kind of equipment here was Yuriy, a very famous surgeon, and he worked in heart hospital named by Shalimov. The materials are very expensive, up to $500 they used to cost for one-time change of these change. And after the full-scale war, and the volunteers and the Minister of Healthcare, they started to procure more of these devices, and now we have around 3 or 4 companies, and thanks to the volunteers and the state, we can say that we almost fully covering the need. But it's not true that I can come to I can use this equipment for anyone, these devices for everyone. And therefore, we with Mr. Dmytro came here to explain how important it is to procure these kind of materials. And if it's not enough, if you do not have enough materials, what do? Well, we are trying to do our best, but in this case, we are surgeons. We are the people who can do not only inside the body, but we can do some technical issues as well. But nevertheless, we are trying to do our best to do according to the protocols. Thank you, Ms. Olha. In the context of the technical medicine and how this device has changed the picture of both preparation and what the soldier is preparing for when he or she goes to the battlefield. Thank you for the question. So let me start from the first time when I tried the vacuum device. That was in summer 2022, when we were asked to support with logistics for the wounded British soldier. And that was the first time when we arrived and I saw this interesting device. It looked just very interesting, very unusual, because typically you can see some wounds and you can see drainage there, you can see the tube and the white thread, and something is... There are also lots of stains, and then everything is covered with film, everything looks nice, something is gathered, something is collected in the container, and at that time the surgeon has explained us, the one who was with this British soldier, he said that luckily they have 2 vacuum devices and they can use them, and that is useful, as the doctor said, to reduce the risks of the further infection, because you do not need to change the bandage so often, because every time you are changing it, it's opening and closing the wound, and the people who are doing that, the staff, some of them can be neglecting the sanitary standard, and if something is wrong, then you have to start everything from the scratch. The vacuum devices, they are reducing the risk of reinfection, and because there is no aggressive impact of the external factors, and therefore the wound is healing faster. And as for the people I'm working with, no one wants to be thinking that they will be wounded, because that's a very painful thing. Because me as a TechMed instructor, I have to tell the people that they can be wounded. That is something that can happen because we are not playing computer games, so that is something that is happening with your body, with your life. And if you are wounded, there are some certain actions you have to undertake, and you have to understand what to do. And for them, it is important to understand that if something will happen, they get the qualified medical assistance, because the things which are happening in the trenches, for me as for the combat medicine, the doctors are saying the life is above the house. So the doctors do not like what we are doing, but then they have to manage with the consequences. And thanks to the doctors, the people are alive. And after hours and sometimes the days people spent in trenches before the paramedics can meet the soldiers, you can understand how infected are these wounds and how important it is for the assistance provided to be at most sufficient. And in my opinion, if I will be wounded, I want to be sure that if I'm wounded, I will get some treatment, and I do not want them to tear bandages a few times a day from my body and making me feel pain, and to ask for the medicine because I'm in pain. And considering the fact that we're in the 21st century and the technologies move further, it's so great that we have these kind of guarantees that we can say that yes, indeed, if you are wounded, you will have the medical assistance. You will not need to suffer with the bandages. You will not need the volunteers to get the bandages and to send the bandages, because bandages is something that you have to buy. They are not free of charge, and therefore why not to spend this money, these efforts in another way, and to procure these vacuum devices. And speaking of the trenches, so how is it possible for paramedics to use these devices? No, it's mainly used in the hospital. That should be the person who knows how to use it. Beside that, it has to be done in the sterile conditions, and in the trenches you cannot find that. And whether it's possible to use it in the stabilization point, well, if I'm wrong, please correct me, but the vacuum devices are used during some period of time. It's not something the short time. On stabilization point, the wounded are there for 1, maximum 2, and maximum 3 days, until you can stabilize the defender for him or her to be able to cover a few hours on the way. So they are doing their best to do something with the body for to help somehow, but these kind of systems and the vacuum devices are used in the hospitals, because that is when the patient has to stay in the hospital for weeks, and it has to be sterile because there is no sterility in the trenches. Let me add a bit. So why on the first stage of the medical assistance we are not using these devices? And I think that it can be even the problem. So one of the first reasons is bleeding. After a short time after the wound, you're bleeding, and the main problem the paramedics has is to stop bleeding. The vacuum therapy, it works with negative pressure. So the blood pressure, for example, 120, 130 millimeters, and the main pressure, the vacuum devices work with the soft tissues is 120, 130. If you have any kind of bleeding, any kind of small capillary bleeding, you will lose lots of blood. So that is the reason why they are not used. And Mr. Andrew, the question regarding your experience, maybe in the context of the UK, how did you use this kind of devices? What is your experience of using these devices, and why do you think they have to be used in a more centralized way?
Most of my experiences are based in Ukraine, not from the UK. I've never suffered from serious injuries.
I will translate.
So, from our experience here, wounds, from a soldier's point of view, if you know there's a technology out there that can save you weeks and weeks and weeks of pain, to save your limbs, your organs. If you know that technology's there and it's not being implemented, it's going to make you doubt and worry, and you need that peace of mind to know that if anything happens, whether it's civilian, whether it's military, it's not just about the army, this. I understand why we're here. It's about knowing that you've got the technology there that can make your life as back to normal as it can get. And it comes down to what value do you put on a human? In the 3 years that I've been in Ukraine, we brought in millions of pounds worth of aid. We brought in VAC machines. Obviously, when we got them originally, I didn't realise that the accessories are the expensive item. I know no different. We've experienced it firsthand, where a soldier, we got a hospital a VAC machine. They applied it to funnily enough, a British soldier, and the wound. Did you talk about that? Great, no problem. We witter on a lot. And it does go back to, we can't, just because the world keeps changing, just because everyone keeps changing their ideas, these things are probably one of the most important things, because it's not just for military, it's civilian and military. To have 4,000 VAC machines and not be able to use them, what's the cost of a life? It helps with macro deformation. It helps to stabilize the wound. It removes extracellular fluids. There's a list of things that these machines do. What it boils down to, it helps someone get better quicker. It boils down to, it's 3 years is a long time, and funding's always hard to get, but we just got to keep going. Every little bit helps. Slava Ukraine.
Героям
Slava Nazi. Ukraine. Putin.
Дякую.
Mr. Dmytro, we will return to you. So in fact, what we are discussing at the moment, that is the advocacy element. So we have discussed how important it is, and we mentioned that we lack something, the materials and maybe some financing. So what do we need to do to improve this situation? Well, there is the solution because we are already working on these for 3 years, and the main challenge is that there are lots of models and the producer, the manufacturers want only their accessories to be used with this equipment. We found the solution in the universal connectors and accessories, and we have tested that and the doctors have proved that it works, and therefore there is a possibility to provide with the accessories which can help all these devices of all those exotic producers to be operating. And first, we started to communicate with TCI company, and this company does not exist, and 3M has bought it because that is the best equipment which is producing the vacuum therapy devices. And in these 3 years, we agreed about the best conditions and best prices from the company, from 3M, from Genodan, the Royal, and the special prices. That is their contribution to our fight, and it's almost the bare price, and therefore charity foundations like Call and the others can procure these accessories officially through humanitarian declarations. And we have worked on the logistics, on the logistical chain. We have the contacts of more than 60 medical facilities, and we get from them realistic request for the accessories which can help them to continue providing assistance non-stop to those number of the wounded which we unfortunately have at the moment. 2 more things which in my opinion can help us as the charity foundation to continue providing assistance. And once for 3 months we meet with the Ministry of Health, and the ministry thanks us because indeed we are not because the ministry say they do not have the capacity to cover all the needs, and without you we couldn't have managed that. And for all of these things to happen, we need the society to understand that there is this kind of need, and that we cannot help those affected who sacrifice their house for us to be able to drink coffee in the morning. And that those corporations, those big businesses which can provide us financial assistance, for them to do that, because indeed Ukrainian business is donating really a lot, not only business but Ukrainians in general, and that is really aspiring. But nevertheless, we need the funds not only for prosthesis, for rehabilitation, not only for the drones, and maybe as a bit of these, a part of these funds have to be allocated here, because if we provide assistance on time, then the number of amputations will decrease significantly. And I think that my colleagues, the surgeons, will prove that, and they can tell you the numbers, and the number of deaths can be decreased as well. And then the person who, after amputation, that is disability, and the society has to spend funds and to socialize these people. So that is a huge problem which unfortunately already occurred in Ukraine, but nevertheless these first steps, in my opinion, they can significantly decrease the problem. Thank you. So the question to Mr. Dmytro and Mr. Yuriy, maybe from your practical experience, maybe you've heard something. So have you had the change that the person who should have get their limbs amputated remain the arms and legs? So what does it cost for the facility and for the state if the defender has all his legs and arms with him? So I will add a bit on what Dmytro has said. As for need for the accessories, for the materials, so the accessories and the other things, until we close the defect, cover the defect of the soft tissues, we need a few sessions of the vacuum therapy to prepare the wound. In our hospital, that is around 3, 5, 8 sometimes operations on one patient. We had the serviceman who had 52 surgeries on one wound. And of course you understand that it's all of these are the materials we're spending during the operation, during the surgery. And as for the healing process, and of course this therapy is mainly for preserving the life and the health of the patient, and it is making the defect to cover faster. And as for amputation, we, from the military perspective, we are on the 5th stage of treatment. And therefore, most of the patients who arrive to the hospitals, 98-97% of them, they have their problems resolved with regarding the amputations. It's very rare occasion when we are the ones who are doing the amputation. Why? Because the wounded get to us after some period of time after they were wounded, and the question regarding amputation is already resolved at this point. And if to speak about vacuum therapy on the first stages, I would express my opinion regarding using these devices on the bottle points. I consider that we can use it on the stabilization point if the bleeding is if there is not bleeding. Stabilization points, they have to stabilize the patient and to stop bleeding. And after that, they move to this next stage. The number of amputations in our hospital, thanks to vacuum therapy, has decreased a few times. Why? Because I cannot give you the exact number. For example, in my department, in the last year, we had only 4 amputations. Just 4 amputations. I'm not going to tell you how many servicemen we treated, but only 4 got amputations. Using the vacuum therapy makes the healing process faster, and it helps to prevent some other problems. And as for the way how the patient feels, I already mentioned that the patient doesn't feel that much pain, the healing is faster, and it prevents the further and it helps to prevent some side effects, and also we, as already mentioned, that you can use it not only from the on the soft tissues, but also it can be used inside the body, and it can be applied in the intestines, in the internal organs, and we are treating abdominal sepsis with these devices, and also we are using theoretical vacuum therapy on pelvis and after the auto wounding. And that is a unique thing which can be used in different ways. How the hospital and the doctor has to be, how many, so what numbers are we talking about? How much materials do you need? How much do you need? And if you lack, then what it can lead to? Well, it's not a simple question. So how many devices do we need? For example, in the department, on the average department, I think 50% of the department has to be provided with the vacuum therapy devices at the moment during the martial law. Of course, when we didn't have the martial law, we need only 5-6 devices in normal times, and they are going to work, they are going to not going to lie in the shells, but at the same time they are not going to work 24/7. At the moment in our department we have 16 devices and they work 24/7. And when we are talking about the materials, accessories, let's not forget about the resource of the equipment, because yes, indeed, half of these devices, Shenadin has provided us from Shenadin through volunteers for the Department of Health or directly through the hospital. And lots of the devices come forward which were delivered by the department and the Ministry of Health. But nevertheless, they have their own capacity. And the capacity resource is close to its end. And therefore, there is not only our charity foundations, but also other volunteer organizations. They can pay attention not only to the provision of the materials, but also to provide with the new devices to substitute the ones which are already not operating. And when using the vacuum assisted therapy has no alternatives. So at the moment there are no alternatives to this kind of treatment, and our servicemen, our defenders who are on the front lines at the moment, as Ms. Olha said it right, the technical paramedics, our defenders, they have to know that we will give all we have for them to be able to return to their families, to their children, to their mothers, and if possible, to adjust, to socialize. And yes, indeed, the amputations, considering the fact that Kyiv is after 2022, when the front line moved, pulled back from the front line, we are the rear territories, and the patients from the other hospitals arrived to Ukraine, for example, from Dnipropetrovsk, Sumska, and Kharkivska Oblast, where they were given specialized assistance. And there is no issue regarding amputation, but there is an issue of re-amputation, because it's a very specific question. For prosthesists, we are communicating with prosthesists very close. So the representative of the prosthesis company, they come in and they say that we need to change a bit the shape of the body, and then we have the wound, and then we need vacuum therapy. For some patients, 1-2 operations, surgeries is fine. For them they need 40-50 surgeries. But the alternative in treatment of the infected purulent wounds does not exist. And let me add regarding the needs which we are facing at the moment. The numbers are very high, and in our hospital, the average number of materials was spent, if very not precise now, around 450 bandage packages, and I'm not talking about device at the moment. In addition to that, we have containers. The price of one container, I'm not going to dive deep into details with the manufacturers. So if we take the commercial price, the market price, it's around $40-60 depending on the size. So you can see the need, and I can tell you more information because we are collecting the information from different hospitals. The average package, considering the prices we can get from the manufacturers, is around $280-300. If all the bandages are changed in 48, 72 hours. And I can see that it doesn't work this way all the time. And I don't understand why, because we are in deficit. And the doctors say, yes, indeed, we allow these bandages to stay a bit longer, because if you do everything according to the protocol, in this case, $280, $300 per each patient, so sometimes more, sometimes less. The number of wounded is classified information, but if we polarize, we can multiply 300 by number of the wounded people, and we can see the need. So at the moment, we have collected the official request from the hospitals, and at the moment, from 30 hospitals, something. So with our small prices, it's around a few $100,000. Yes, $200,000. It's something significant. Yes, Miss Olha. Speaking of, you agreed with the manufacturers that we can procure the accessories cheaper. And as for the person who is already in the hospital, who already gets this vacuum therapy, and the hospital doesn't have the materials, in this case, what happens? The family, the friends, volunteers, they start suddenly to collect money and to procure these materials where they can find them on commercial prices, which are much higher than what can be procured and provided. And some families, first of all, if it is the case of the serviceman, for him or her to get the payments of the wounded, it takes time. So that's because of the bureaucratic issues. The paper army is the strongest one, but nevertheless, servicemen typically get the payments. But as for civilians, we constantly have the attacks, the drone attacks, so lots of civilians who are affected by that. So if it is kind of granny from the rural area, and she was brought here, and her pension is $100, her children are abroad, or they are not alive anymore, so how can she provide herself with this treatment for her to be able to survive, to live a few more years? So she will not be able to open a fundraising campaign because she has a button phone, because she has never used smartphone and she doesn't know how it works. And when volunteer movement, and then there is another aspect. So I deeply appreciate every volunteer who helps, because me as volunteer who does it since 2014, and it's very difficult. It takes a lot of efforts when you get the vacuum devices, which we get from the hospitals. The hospitals get rid of them not because they just don't want them. So they are close to the end of their life cycle. So yes, okay, we can repair them. They can work for some time here. But once again, the capacity, the working load, considering the situation, what we are facing, and how many people get wounded, the capacity has to be, the working load is incredible in the hospitals, and people are not able to bear that. And of course, the devices are not able to go with it. For them, it's even worse, and therefore we have to find the new devices to substitute the ones we used. So the ordinary person cannot procure the vacuum therapy device, considering the accessory and the materials one needs for the treatment, and therefore it's much better when we are talking about how to use the resources, the financial literacy. If we engage big companies who are able to help to procure it on the bare price, on small price, it's better than volunteers and relatives collecting money and buying everything on commercial price. So you can buy it 2 times or even 3 times more than you can buy in this way. So you can provide 2-3 times more people with these devices, with this treatment, because the doctors, I met lots of doctors who take the money from their own pocket and they buy what the patient needs, and that's not right, because everyone has family, everyone has obligations, and they need food. Some of them have children and they have to pay for their education, they have to pay utility bills, and then the person who is unfamiliar for me, but my heart is in pain for him or her, and I spent my own salary to buy what this person needs, and then I will come back home, I will have problems at home, and it's on the scale of the country. And if we will unite like we did in 2022, for big companies it's not going to be so painful to spend the part of their income to procure these devices, these materials. Thank you, Ms. Olha. So we understood what we need. The only thing we did not understand how we can do that. So maybe we can ask Mr. Dmytro. We were talking about big business. Maybe you had some negotiations, and maybe you're on the way to some solution. If not, then those who maybe watch us, maybe the ones who how can they join this process? So that is a cooperation with you directly as NGO, or maybe they need to create some additional association. Well, in all this time we brought 380 devices to Ukraine, almost 10% of what was brought to Ukraine during these 3 years. We engaged funds in 2023-2024 from international businesses, that is OLX, that is Unilever, and also the companies which do not want to be named to some certain reasons. And now we can see that the world is not that willing to donate. It's quite hard, and we do understand the reasons, so it's not going to stop us. And we understood how much Ukrainian business donates to support the army and the medical directions and humanitarian directions. We understood that we can ask Ukrainian business for help. And as for the volumes of the scale of support the business provides to cover this need, and that is just a small percent. Why Ukrainian businesses are not doing that? Because this information, it's not something people are speaking about. So this problem is not well known. Only specialists and medical staff and they know about this problem, but society hasn't heard of it. So therefore, I would like to have more of these discussions to deliver the message about this need, and through society to the heads of the international and Ukrainian cooperation, that this direction requires their attention, and some people require their financing. Well, and therefore we organize this meeting to emphasize the specific issue in this specific area, and in my opinion it's much better than something general, just we need funds for everything. When you're talking that what you need this money for, and summarizing this discussion, Mr. Dmytro, well, if someone will hear us, someone from big business, so what can they do? How can they move towards this cooperation? So at any time they can contact our charity foundation. We have the official request from the hospitals, which are verified by the Ministry of Health, and we want to do that with the commandment of the medical headquarters, and big businesses can choose one of the projects, and every medical facility in their need is a project. So you can take care of one medical facility, and you can cover the quarter needs. Let's hope that something will happen and this war will stop. So let's go quarter by quarter, and if business can cover some certain medical facility or the oblast or something more specific. So, for example, Mechnikov's hospital, which gets lots of patients, they have the need of $125,000 per quarter, around $10,000 per month for the hospital. It's not a very big money, but as doctors say, it's something you cannot move further without, and the relative, they cannot always are able to buy it, and if they are able to do that, the prices are sometimes 3 times more expensive than the ones we can get these materials. So the solution we have is to take care of some certain hospital. That is a solution for the big business. The second one is the reserve fund, and if there is a strike somewhere, we have some certain number of devices which we can provide to some certain facility, medical facility, for them to be able to provide assistance to the big number of the wounded on locations, and also some materials. And the third direction, that is, as my colleague said, we have to change the park of the devices, because they are close to the end of their life cycle, and many of them, they entered Ukraine being used, and that is a third direction which also requires support. Thank you very much. There are some solid solutions we have to work on, and let's hope that we will be heard by those who can help to resolve this problem. And I wish you is something I wish not only to you but also to all of us, because all of us are alive, all of us are human beings, and whatever happens wherever we are facing the health issues, and I hope that our medical system will be improved. And to make it happen, we need these kind of devices for us to understand how efficient all of these things and how modern these things are. So let's hope that the next time you will come to our studio, you will have the implemented projects with the numbers, and you will be able to tell how many new partners do you have in this area. Thank you very much for the discussion and for the work you're doing, and I would like to thank our audience for your attention, and please join us to resolve these problems together. Thank you.